Chapter 13. The Overseas Doctor. Types of registration. To manage and treat patients in the UK, all doctors must register with the General Medical Council. There are several types of registration. Provisional registration is for doctors who have just qualified from medical school in the UK or from certain European Economic Area member states. Full registration is for doctors who have completed their year's clinical training. Limited registration is for international medical graduates who have not completed the equivalent of a year's clinical training in the UK. Specialist registration is for doctors who have completed specialist medical training and have a certificate of completion of training. The GP register is a register of all those eligible to work in general practice in the NHS PLAB. Before they can obtain full registration, some category of overseas doctors are required to take professional and linguistic assessment board test. PLAB is designed to ensure those who pass can practice safely at a level of an show in a first appointment in UK hospital. Part 1 consists of a written test of knowledge, skill and attitudes. Part 2 is an objective structured clinical examination. It consists of 16 5-minute clinical scenarios known as stations to assess professional skills. PLAB stations and advice. Clinical examinations. Your ability to carry out a physical examination of a simulated patient. An actor training to play this role will be assessed. Uncomfortable or intimate examination will be carried out using mannequin and anatomical model. Practical skill. You will be assessed on practical skill such as suturing and giving intravenous injections. Communication skills. Your ability to interact with a simulated patient, or in some cases, the examiner, will be assessed. Skill tested may include breaking bad news and giving advice on lifestyle. History taking. Your ability to take an accurate history and make a reasonable diagnosis will be assessed. Advice on the station from a successful candidate. Read the instructions outside each station carefully. You have 1 minute for this. Keep in mind safety precautions like throwing the sharps in the sharp bin. Don't forget the ABC, airways breathing circulation protocol in every emergency station. Check the patient understands what is happening, then ask them about any concerns they may have. Don't just give a lecture, listen carefully to what the actor says. Exercise. What kind of registration might this doctor obtain? A newly qualified Spanish doctor, a newly qualified Nigerian doctor, a doctor who has successfully completed the first foundation year, and show who has successfully completed the foundation program and gained a certificate of completion of training after several specialist registers posts. Write the abbreviations in words. Look at A, B, and C opposite to help you. Any doctor who wants to work in the United Kingdom must register with the GMC. Some overseas doctors must pass the PLAB test before they can register. Part 2 of the test consists of an OSCE. In any emergency, remember the ABC protocol. Before you can obtain specialist registration, you must have a CCT. Complete the test. Look at A, B, and C opposite to help you. My name is Musa and I come from Yemen. I came to the UK about 2 years ago after graduating. Because Yemen is outside the EEA, I could only obtain blank space with the blank space at first. It was very difficult for me to obtain a place on a foundation program. Although I speak good English, I had to take the Black Space test to show that I could work safely in the UK. If I have to give some advice to other candidates, it would be that at counseling, Blackface, you shouldn't simply memorize a set of phrases. It's better to really think about what you're saying to the actor and get the intonation right. After completing my year's clinical training, I was able to obtain blackface, but I found it difficult to get a show post in my chosen specialty, pediatrics, as hospitals now have to demonstrate there isn't a suitable candidate from the EEA. Once I completed my second foundation year, I should obtain a blank space. Will be allowed me to proceed to blank space with the GMC, an important step on the road to becoming a pediatric consultant.